Chapter 4, Recording 3. Communicating with children can be very difficult. Even the older adolescents sometimes struggle to adequately communicate because they're scared. Fear is very obvious and severe in children. If they aren't scared or overwhelmed, they're lethargic, or meaning they're sleepy, not really with what's going on around them, that's a sick kid. Kids normally are very, very responsive to us, be it fearful, over talkative, wanting to show us things, or just really interested in what we're doing. Children tend to be more frightened by our position of authority, our infamiliarity. The ambulance, while very fascinating to some children, can be very intimidating. When children get hurt or injured, people tend to crowd around them and they get very overwhelmed by all the stimulus. Let them keep a favorite toy, doll, security blanket. Typically, most kids will attach onto something. Let them keep that with them if at all possible, but by God, don't lose it. I know that my kids, if you lost their, what we called a lovey, all hell would break loose. So make sure that you pay attention to where that thing is at all times. If possible, have a family member or friend nearby. If you can have them hold the child to calm them down, that's certainly helpful. Mom or dad having an arm around or holding the hand of an older child may significantly help out in your situation. Kids really crave stability and routine. So anything that deviates from that really can throw them into a tailspin, even if what is happening, in your opinion, is relatively mild. You're still throwing them off their routine. You're taking them out of something that they're used to, and that right there can absolutely send their anxiety through the roof. Be honest with them. Children very, very easily can see through lies or deception. Even young kids know that you're not telling the truth, and losing the amount of trust that you've built with a child, you will not get it back. The first time you lie to them, or the first time they don't think you're being truthful, you're done. Tell the child ahead of time if something will hurt. If they ask you if it will hurt, and there is the chance that it will, let them know. Yes, this is going to hurt. One of the things that I like to tell to kids is, yes, this is going to hurt. You are allowed to cry. You are allowed to scream. You are allowed to be scared, but you have a very important job. You have to stay still, and you cannot kick or hit. That lets them know that they can feel the emotions that they're feeling, that they have ways of letting that out, but you set the boundary of, you cannot hit, you cannot kick, and I need you to stay still. Calling it a job makes them feel like they're important. If I give my kids a job to do, especially my little one who's about 4, if I say, I have a big job for you, can you help me sweep the kitchen? He feels important. He feels in control of what he's doing. It works with kids of all ages. Try not to talk down to those older ones. You know that you hate being talked down to or patronized. So just say, hey, this is super important. Respect their modesty. It kind of depends on what age a child is at, whether they're super modest or not. The older they tend to get, the more modest that they are, especially once they hit puberty. Little kids, not so much. They enjoy being naked. Oftentimes, they do not run around their house fully clothed. A parent is constantly putting clothes back on them. But as a general rule, start with modesty and let them kind of guide you with what they're comfortable with. Speak in a professional, friendly way. Don't talk down to them just because they're a kid. Don't use baby talk. Definitely talk in a way that's going to make them comfortable, but don't baby talk with them. Maintain eye contact again, and try and position yourself at the child's level. Oftentimes they're significantly shorter than us, and getting down to their level helps with that communication. Hearing impaired. Most of them have normal intelligence. Just because they can't hear or communicate doesn't mean they aren't very highly intelligent. They're not embarrassed by their disability a lot of the times because they've been dealing with it for a while. Now, some of the older generation that have progressed to hearing loss, they tend to be a little more reserved with that just because they used to hear, they used to have normal conversations, and as they started to lose their hearing, they did a lot of what? Or, can you repeat that? And the people around them tend to get frustrated. And so my grandma, for example, woman can't hear a thing unless you say a cuss word in her presence. She always seems to hear that for some reason. But normal conversation, she will nod her head and smile and say words like yep or uh-huh. Didn't hear a word you said. So that's more of a little bit of an embarrassment. Most people that have a true hearing impairment, they're not worried about it. This is their everyday life. We've talked about positioning so they can read your lips. Hearing aids can be very important. Ask the family if the patient's confused. Make sure that they have them. Make sure that they have them on. If they have hearing aids and can't hear you, just double check with them that they've got those on. Have a paper and pen available. We oftentimes will carry a favorite pen in our pocket. Having a little notebook can be helpful as well. Don't shout at the patient. We've already talked about the older generation. Just keep it at a normal level and adjust from there based on what you need to do with them. Listen carefully, ask short questions, learn some of the signs for sick, for hurt, for help. This can be really helpful. Sometimes even when they haven't grown up with a hearing impairment, they haven't learned to be fluent in sign language. Sometimes they will actually learn a little bit so that they can communicate needs. When you're talking with visually impaired patients, if they're having a hard time seeing what's going on, they may have any varying degree of visual impairment. Ask them what they can see. Oftentimes they're not completely blind. Sometimes they may see shadows, they may see movement. So define where they're at. Expect the patient to have normal intelligence just like a hearing impaired patient. Explain everything that you're doing as you're doing it, maybe even before, even just simple movements. Let them know, hey, I have to reach up above your head for this. You're going to hear a cupboard slam because I have to grab this piece of equipment. When you take them out of their environment, which they are very used to, oftentimes they can navigate through their home without bumping into things because they're very aware of where they're spatially at and where their stuff is fixed. Once you take them out of that, they become very uncomfortable. Their hearing tends to be better because it's compensating for that loss of that other sense. So they pick up things you don't necessarily think they would, and it can be very anxiety inducing. Try and stay in physical contact with the patients as you begin care so that they can acclimate to you. If the patient can walk to the ambulance, that's fine. You can guide them or ask if you can guide them. Try and transport any mobility aids such as a cane with them to the hospital so that they have that for them. At some point, they're going to get out of the hospital, and that literally they wheel them to the door and go, okay, bye. They typically don't give them a lot of help, or they'll get them into the vehicle, but then how does that patient get into the house effectively if they don't have their mobility aid? Guide dogs, Oftentimes they have a special harness. They are not required by law to have a special harness. Most people will keep them on just because it prevents questions, but not everybody has to have that. If possible, transport the dog with the patient. A lot of hospitals will make provisions for those animals because of the necessity for the patient. Definitely alleviates stress for both the patient and the dog. The dog is very in tune with their owner. They've been trained a special way to take care of their owner, their patient. And when they get separated, that can be extremely hard for both of them. If you can't do that, try and arrange for care for the dog. Before you leave the house, if it's not a load and go situation, hey, is there somebody that I can call to come take care of your dog for you? You can do that in the back of the ambulance as well if it's not life-threatening and they're semi with it. Otherwise, if they are completely out of it, things are not good, you don't have a next of kin, alert the hospital that they had a dog. Oftentimes they're going to be able to get in contact with the next of kin and just say, hey, we left the dog at home. Non-English speaking patients. This is probably one of the most frustrating because you know that they're talking, you know that they can talk, but you don't speak the same language. You have to find some sort of way to obtain a medical history. Find out if they speak any English. Try and use short, simple questions. We often talk with our hands a lot. Slow down a little bit. Point to parts of their body. If they have a family member, have them interpret for them. However, keep in mind that whatever you're going to get from that family member may have biased information in there and may lead you a little astray of what the patient is actually trying to say. We do have interpreter services as well. If your service has that available, they will make that known and you can follow that. If not, the hospital does have interpreter services as well. Some of the cooler new age things are like Google Speak, where you can talk into it and it will translate it into a different language. Again, English doesn't necessarily straight translate into other languages, so it might be a little bit interesting, but at least it's a place to start. For large populations of a different culture or different language speaking group, it may be helpful to learn common phrases, maybe some pocket cards, that smartphone app. There's several out there. I tend to use Google myself, but it may help if you're constantly exposed to the same group of people. Remember to request that translator at the hospital. They will have one. Communicating with other healthcare professionals. We tend to have the good old boys club with our own group. So paramedics, EMTs tend to have ill thoughts towards other healthcare professionals. Nurses, we oftentimes get talked down to, and we're trying to break that cycle with you as the new oncoming group. I do an IPE event, an interprofessional educational experience, down at the college with my medics, with nursing students, with laboratory students. We often include the PA students as well, and then the PT students, so that we each get an opportunity to expose to the other careers and what they're capable of. Most of the time that disconnect is just because they don't understand what we know or what we do fully. Even nurses that are around us all the time, if you haven't been out in the field, it's tough to know what you're doing there. We may do okay in a hospital setting, but it's still a different world. And so being accepting of those different situations, definitely helpful. When you are giving report to a hospital staff member, make sure that you're giving report to somebody that's at least at your level of training. Don't start spouting off to the tech, doesn't mean that they won't understand what you're saying, but they're probably not the person that can control how the patient is going to be cared for or what orders need to be put in. They have a scope of practice just like we do. So nursing, flight medic, something along those lines or higher. Oral report components. These are very important, and we tend to create our own template for how we give report to somebody. Radio report may be different than handoff report in the hospital, but every single time they need to contain certain information. Opening information should be the name of your patient, chief complaint. Chief complaint is what they're complaining about, not necessarily what we think is wrong. Then it can be the illness that they're experiencing, detailed information that you didn't provide during your radio report, or maybe just do another quick run through how we found the patient, any important history that the patient has talked to us about, to kind of set up the scene. What we did for the patient needs to be in there, and any sort of response that the patient had to our treatments. Vital signs are important as well, and then sometimes there's other information that you gather during transport. Any articles that you brought along with the patient, make sure they know what they've got and where you put it. And then anything specific or important that the patient told you during transport, especially if it may affect their continuum of care. We'll go ahead and stop here and continue on in the next recording.